Senator Smith.
Mr. Chair, thank you. Thank you, Mr. Chair and Ranking Member, and welcome, Mr. Kennedy. So, Mr. Kennedy, I don't have a question for you on abortion. I think that my colleagues on both sides of the aisle have covered this, but I want to say I can respect people who have different views than mine on this issue, but it's hard for me to respect people who won't give a straight answer to what they think on this issue in particular. Mr. Chair, I just want to note that I understand that anti-choice advocates have said that in these hearings they were looking to hear Mr. Kennedy provide some reassurance that he is on their side, and I'm not hearing that. And I think most Americans are looking for some hint that the decisions that people make about abortion should be personal and private, and they should be free to make those decisions without government interference, and I'm not hearing that either. To make it worse, the answers that you have given tell me that the Trump administration is more than willing to restrict or even ban medication abortion without a single act of Congress, and even in states where abortion is legal. And what is clear to me is that you and President Trump are dangerous to women's access to mifepristone. So having said that, I want to move to a different topic. Mr. Kennedy, I appreciate Senator Cornyn's questions about mental and behavioral health, something that I care a lot about. I know that you and your family have had personal experience with mental health challenges, as have I. And I agree that the mental health crisis in this country is a crisis. So let me ask you, in an interview in 2023 and again in 2024, you blamed school shootings on antidepressants. You said, and this is a quote, "There is no time in American history or human history that kids were going to shoot schools and shooting their classmates. It really started happening coterminous with the introduction of these drugs, with Prozac and with other drugs." So do you believe, as you've said, that antidepressants cause school shootings? This should be a simple question.
I don't think anybody can answer that question, and I didn't answer that question. I said it should be studied. So your answer is? I said it should be studied along with other potential culprits, like
so they may cause
social media. But I don't know. I would never make, because there's no science on that,
well,
Senator.
There is, Senator. I mean, excuse me, there is, Mr. Kennedy.
Thank you for the promotion.
The science shows that there is no link between school shootings and antidepressants. And in fact, most school shooters were not even treated with antidepressants. And of those that were, there was no evidence of association. You know,
I don't think you can say that, Senator, because of HIPAA rules, nobody knows.
Well, that is, Mr. Kennedy, do you think that people who take antidepressants are dangerous?
I think, listen, I'm not going into HHS if I'm privileged to be confirmed with any.
So you can't say that people
to impose any preconceived ideas that I may have. I just want to have good science.
So you're not saying that they aren't dangerous, which means that they could be dangerous. Let me ask you this.
That's not true.
You've described Americans who take mental health medications as addicts who need to be sent to wellness farms to recover. Is that what you believe?
No, of course I didn't say that anybody should be compelled to do anything.
No, but you said they should be sent.
I said they should be available to them. I didn't say they should be sent.
You said that folks that take antidepressants are like addicts. That I can provide that, Mr. Chair.
I think they should have the availability. Listen, I know people, including members of my family, who've had a much worse time getting off of SSRIs than people have getting off of heroin. It's the withdrawal period is, I mean, and it's written on the label.
I have some experience with this myself, Mr. Kennedy. This is personal for me. When I was a young woman and I was struggling with depression, thankfully, I had the resources to help me get through it, including a new generation of SSRI uptake inhibitors, which helped to clear my mind, get me back on track to being a mom and a wife and a productive, happy person. And I'm really grateful for that therapy. So I have some experience with this, and I think that everyone should have access to that care. And your job as secretary is to expand access to care, not to spread lies and misinformation. And, you know, the things that you say, Mr. Kennedy, they live on. They have impact. And, you know, we're having this conversation at the same moment that my Republican colleagues are looking to try to figure out how to save money any way they can. And so they want to cut Medicaid. Let's just think about this for a minute, because you're going to be, should you be confirmed, you would be responsible for CMS, which provides mental and behavioral health care to millions of Americans. Close to 40% of folks on Medicaid have a behavioral health condition. And you would be part of this administration that would be looking to cut Medicaid. So, Mr. Kennedy, these statements that you've made linking antidepressants to school shootings, they reinforce the stigma that people who experience mental health every day face every single day. And I'm very concerned that this is another example of your record of sharing false and misleading information that actually really hurts people.
Senator, you're mischaracterizing my statements.
I am only putting into the record what you have said, Mr. Kennedy.
You're mischaracterizing my statements, and I'm happy that you had a good experience on SSRIs. Many Americans have very good experience on it. Others have not.
That would be an issue between them and their physicians, and not for the future head of HHS to be putting out misinformation about the dangers of SSRIs and other antidepressant medication, spreading the stigma and the fear that we're actually trying to overcome.
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do. And
That's all I believe, too. And you and I are in agreement, Senator.
And to your point that you made when you made these statements, it was not based on good science. I don't know what it was based on.
I was saying the science needed to be done. I was saying these are potential culprits. We're coterminous, and I named other things. I said video games. I said social media. I said SSRIs. SSRIs have a black box warning of suicidal, homicidal behavior.
Mr. Chair, I will submit to the chair the information that I have about what Mr. Kennedy has said of linking antidepressants to school shootings. Thank you.